Hello, my name is Natalie Phillips and I'm Clinical Manager at Adam Healthcare. I'm also a lymphedema nurse specialist and a senior trainer at the Lymphedema Training Academy. In partnership with the British Lymphology Society for Lymphedema Awareness Week, I'm here to talk about how to help patients manage their compression effectively. Many of the considerations within this session have been discussed by Justine Whitaker in her session. However, I'm going to revisit some of the points, some of the basic points to consider prior to garment prescribing, which will ensure you are halfway there to helping patients manage their compression effectively. For this session, we will focus on the lower limb compression as this is more relevant to primary care. However, considerations can be applicable to any patient who requires compression therapy, including those with arm lymphedema. Time is often one of the most common constraints within the clinical setting, and we often hear clinicians report that they struggle to ensure that there is enough time to measure and select compression therapy. However, one of the biggest implications of not having correct compression is further deterioration of the patient's limb condition and increased risk of complications such as cellulitis or recurrence of wounds. This in turn places a bigger burden on already stretched services. So if we can get it right early on and see that extra time taken initially will most likely improve the outcomes for the patient, this will in turn reduce future workload. Often we'll start our assessment as soon as the patient walks, if they can, through our door. This can often inform our choice of compression early on. Observing the patient for how they mobilise, do they use walking aids, have well-fitting shoes, or are they attending with a caregiver? What is their body type, for example? Do they have morbid obesity? These will all inform our discussion and choices on the type of compression applicable for that patient. However, it is important not to make assumptions on how we think the patient will fare with compression, as they may do very well, even with mobility and health issues, but it will allow us to build a picture. Observe for how the patient removes their shoes and their clothes so that you can measure them effectively. Are they able to bend down? If not, then how will they get their compression on? In this instance, long-handled hosiery applicators may help, or if your patient has issues with dexterity and pulling on garments, then Velcro straps, fasteners, or zips can also be added to garments to ensure that they're easier to apply. Ensuring that the patient is informed as to why compression is needed, what it does, and why the fabrics differ can really help to increase concordance with wearing compression. Quite often, patients come with preconceived ideas of how compression is or have had previous negative experiences. So explaining that compression should be comfortable and well-fitting and should not cause pain or discomfort or trauma can often reassure the patient. Also discussing the differences between a flat and a circular knit garment can help reassure the patient, especially if you are going to use a flat knit garment, letting the patient know that although it's slightly thicker, it will reduce the risk of their edema getting worse, and that they're actually also easier to get on. There have been many instances where the patient has not been prescribed or fitted with correct compression garments, and advising that there are many different fabrics, styles, as well as colours and patterns may help to improve concordance and promote a positive body image for the patient. As you prepare to measure your patient, you should also be assessing the type and extent of their swelling. For example, does the swelling affect the toes? So, do they have a positive stemmer sign? You can check this by just pinching the skin between the big toe and the next toe to it. If you're unable to pinch a fold of skin, then this shows that there is edema in the tissues. Looking above knee, does the patient's swelling extend into the knee and into the thighs? Again, this in both instances, this will give you a rationale for advising on the use of a garment that covers the knee and thigh, or is closed toe, or the use of a toe glove as well as a garment. Considering what the tissues feel like, so palpating the tissues throughout the limb to see whether they are soft and doughy or a little firmer with some pitting. If there is pitting edema present, then there is scope that the limb will reduce with garments. And if it is extensive, then should we be considering the patient has a course of bandaging prior to using garments, or uses adjustable Velcro wraps to enhance reduction of edema prior to using garments. If using a garment as first line, then the garment will very quickly become ineffective due to the limb reducing in size. Furthermore, pitting tissues would also indicate the need for a flat knit fabric over a circular knit fabric. And this is because a circular knit fabric will cut in if the tissues are pitting, and as it tries to pull back to its smallest circumference. Quite often, flat knit fabrics are custom made, so you do need to be aware that there are a few extra measurements that will need to be taken if you're going to select a flat knit garment. Once you have selected your garment, it is important to ensure that you have the correct prescribing information for the system that you use. Now, it can get quite confusing in primary care where there is different prescribing systems used on computers. So ensuring that you have the full product description and any relevant PIP or drug tariff codes, and a measurement form if you are using a custom-made garment. These will all ensure that the correct garment is ordered. In some instances, you may not need a custom-made garment, but you need to make sure that you will add to the prescription the unique identifier that is given for that garment from the company. There's also lots of information out there on whichever company's garments that you're using on their website, so that you can ensure that you've got all the correct prescribing information. Garments should not take any longer than 2 weeks from the pharmacy ordering them to the garment arriving. So before the patient leaves, plan an appointment for fitting the garments in clinic, particularly if the patient has had previous problems with tolerating garments or application issues. This will allow you to demonstrate application as well as check that your patient applies them properly using the applicators that you have also ordered. The correct advice can then be given on wear time, washing and care instructions, and what to do if there is a problem. When demonstrating application, it's always useful to have the donning aids available, showing a selection of donning aids to the patient on how to apply the garment onto the aid if a frame, or how to apply the aid onto the limb. Just like getting the compression right, it is always important to ensure that the patient has the correct donning aid based on their needs and abilities, and there's a wealth of them available on prescription. A really useful tip is to advise the patient to use rubber or marigold type or gardening gloves when applying the garments, as this not only enables the patient to grip the garment but also to help redistribute the fabric. It also protects the garment from sharp fingernails and reduces the risk of damaging the garment. On application, advise that the patient does not twist the garment as they are pulling it on. And if wearing a flat knit garment with a seam, the seam should sit down the back of the limb, the back of the leg, if applied correctly. It's important to remember that all garments stretch, so it's really advisable to ensure that the patient does not overstretch the garment. For example, pulling a below knee garment right up over a knee. In the case of a below knee garment, this should sit 2 fingers below the knee crease, the popliteal crease. And again, this is why it's useful to have gloves, because they can then redistribute the fabric. Washing instructions tend to vary depending on the product used. So do check the instructions that come with the garment or for each company. Generally, compression garments are worn in daytime waking hours. However, there are instances under specialist guidance and when patients are observed regularly where they may wear them at night. There is also a group of garments that are classified as resting low compression garments, which can be worn at night. So these garments, your flat and circular knit garments, tend to be worn during the day, so applied in the morning and removed at night. And on removal at night, it's advised to do skincare then, or if doing skincare in the morning and applying creams and lotions, then wait a few minutes before popping the garment on. Generally, compression hosiery can be washed on a low heat setting in the washing machine, but without the use of fabric softener, or they can be hand washed in the sink. Again, using normal fabric softener, not using washing up liquid. Sorry, not using fabric softener, using non-biological washing powder. They should be dried naturally, not in a tumble dryer, which is why we always suggest that patients have 2 sets of garments at least. So they've got one for washing and one for drying. And they should have these 2 sets of garments at least every 3 to 6 months, if not more, depending on their skin condition. Often patients are given these 2 sets of garments, but can purchase more pairs direct from the company if they have the capacity to. This often gives them a choice of more colours and patterns. And it is important to reiterate that if the patients feel that their edema is getting worse, that they are contact yourself, or if the compression garments have become damaged, that they contact you for a reassessment and a reordering of their garments. Manufacturers state that garments should replace every 6 months as they tend to lose their elasticity after this through washing. So there's just a little bit of a whistle-stop tour, and I hope you've found a few of those tips useful for clinical practice when prescribing garments. Do refer to the session by Justine Whittaker on prescribing compression garments, because that will also inform your practice. And there are other webinars in the series, in particular the one by Justine. There is a wealth of information on the British Lymphology Society website, so do have a look at the fact sheets that are available to download, especially on lymphedema and lipedema. And the best way to keep up to date with all clinical resources on the BLS website is to register as a friend or a full member via the link on this slide. Thank you for listening.
Right, hi. Good evening, everyone. Thank you, Natalie, for that really interesting session on how we help patients manage their compression effectively. Good evening, I'm Cheryl White. I'm a lymphedema physiotherapist and I'm BLS editor. And this is Rachel Sutton, lymphedema nurse and BLS trustee. And as you may have noticed, Natalie's unable to join us tonight to answer any questions you may have, but we've been joined this evening by Tess Henry, who's a clinical nurse specialist and lymphedema development manager at Haddenham Healthcare, our platinum sponsor. So we'll move on to the questions. So would you like to ask the first question, Rachel?
Yes, someone mentioned, should products options be restricted within a formulary, which you answered, Tess. Just wondered if you can elaborate on that, please.
Yeah, sure. I think formularies are certainly something that, you know, with the change from CCGs to ICBs, it's certainly a hot topic at the moment that's regularly occurring. And I've certainly seen in some parts of the UK that ICBs have actually implemented compression hosiery formularies, more specifically for the community setting as opposed to the lymphedema specialist clinics. So I think, as you are all aware, there's a massive range of compression hosiery out there, and it can get very, very confusing. So I think most definitely a formulary set up for a community setting can absolutely work, and it can work very successfully, reducing costs and reducing wastage as well. I think for the specialist lymphedema services, I think we really do need to have access to the full array of products. So yeah, I hope that's answered the question.
Agree. Thank you, Tess.
Pleasure.
And Tess, how often should garments be renewed? And we've got another question also relates to that. Can we order every 3 months? I was told only 2 garments allowed every 6 months.
I think it varies, Cheryl, from country to country and region to region. So Wales and Scotland and Northern Ireland have different prescribing patterns, but certainly for within the UK, patients are only allowed to have 2 garments every 6 months. So for example, for a patient that has bilateral lymphedema, that patient would be prescribed 4 garments. So 2 garments per limb. Yeah, as far as the validity or how long a compression garment is good for, most manufacturers will state that it's 6 months. But it is important to always check the manufacturer's guidelines, because some of the companies do actually state 3 months. So it is important. And of course, you also have to always consider wear and tear. So, you know, if a patient's not regularly attending a chiropodist and their toenails are 3 inches long, that's going to make a huge impact. Their hosiery is going to wear out a lot quicker, but general rule is 6 months.
And of course, we've got some patients that are far more active than others as well. That would have an influence on the longevity of the garment, won't it?
Absolutely. Absolutely. Yes, most definitely. Yeah.
And also, for some companies, there are some opportunities for patients to buy extra garments if they so wish as well, isn't there?
Yeah, that's a great point, Cheryl, actually. Yes, many of the manufacturers actually have their own online shops. So, for example, with Haddenham Healthcare, we have our online shop is lymphshop.com. But there are other avenues for buying. So there are specialist DAC providers. So companies such as Daylong in the UK, where patients are also able to buy their own garments direct.
But with the guidance of a specialist, though.
Absolutely, yes. Yep, absolutely. So again, the requirements for that vary according to the manufacturer, but most of them will ask for either a previous prescription or a letter from the clinician, certainly above a compression class 1, RAL compression class 1.
Okay, sorry, Rachel, did you have something to add about that?
Oh, no, I just wondered how they would go about getting their own garments first. Would they contact yourselves at Haddenham, or Daylong, or go through their specialist therapist?
Actually, all three of those routes, Rachel. So yes, they can in fact contact Haddenham Healthcare direct. I'm sure other manufacturers also offer that as an available option. And Haddenham, certainly at Haddenham, we have a team of dedicated customer service representatives, and they would guide the patients to via the appropriate channel. And Daylong, I believe patients can again telephone direct and inquire via that channel as well.
Well, thank you. We've got another question. Someone who's been in flat knit for many years finds the garments very thick and hot during the summertime. So he's gone over to cotton, 100% cotton against the skin. And then her edema became worse, and venous eczema worsened as well. And she was wondering if there's more of a breathable flat knit fabric available, and would the reaction probably be as a result of chemicals in the fabric? Do they need washing before trying to wear?
That's potentially a very long answer for that one, but I'll try and keep it as short and sweet as I can. So yes, absolutely. So the easiest port of call is most definitely to look at it from a washing perspective. So that's probably, as a clinician, one of the first things that I would ask a patient. Have you changed your washing powder? Have you changed anything else? Have you changed the emollient that you're using on your skin? Because sometimes that can also have an effect. From a heat perspective, yes, we do know that flat knit hosiery tends to be heavier, simply by default, the way that they're actually manufactured, via flat knit and sewn together. What I will say, however, is there are a number of manufacturers out there that provide a huge variety of flat knit garments. So I would encourage you to have a look, speak with your specialist lymphedema service, and let them know what your problems are, and and look for for alternative flat knit garments. I can certainly speak from the Haddenham range. Pertex is a very, very comfortable flat knit fabric. It's softer and stretchier, so perhaps not suitable for every patient. If it's a firmer type of flat knit garment, you're after, again, within the Haddenham range, the gold punked fabric is certainly a stiffer fabric, but it does provide a lovely silky lining. But again, what I would suggest really is go back to your specialist clinician, and they will be able to access all of the information online to let you know exactly what the composition of the individual fabrics are. So from a cotton content, nylon, latex free. You can probably source some of that online as well.
And I think that's important, not to write off flat knit or circular knit because you've not got on with a particular one stocking. There may be others, from another company or another within the same company, different material makeup, like you say, more cotton content that might suit a patient much better.
Yeah, absolutely, Cheryl. There's, most definitely. And the same, we do have a tendency very much to say, oh my goodness, look at this, the shape of this patient's leg, they definitely need to go into a circular knit. And the reverse is also true. We can make assumptions and say, oh my goodness, this patient definitely needs, a flat knit. But it's with the range of products and the adaptability of what we're now able to do with products, with custom made, also referred to as made to measure, and the wide variation across companies providing circular knit garments and the available options. So there's a variety of widths. For example, you have a standard width and an extra wide. A leg length, you can have a short, regular or long leg, and the same with foot lengths. So, it's there's a huge variety out there. There should never be a scenario where we can't find a product to suit any patient's needs, unless they don't want to wear compression, of course. That could be a problem.
And if a patient can't apply a garment, there's the options of zips, Velcro straps, lots of variations that we can look at as well, isn't there?
Absolutely. And I think from, we're constantly in this situation in clinic where we're kind of doing a benefit concordance analysis, if you like. So we're constantly weighing up, what the suitable options are. And I guess the bottom line is, if a patient can't get a compression garment on, then what are we actually achieving? So yes, it's wonderful to have that flexibility, of offering fastening options. So, a variety of Velcro fastenings, whether they're horizontal or vertical. We have the option of zips. As a lymphedema specialist nurse, it's always my last port of call, would be to add things, zips or Velcro. And the simple reason being that, we are compromising the profile, the compression profile. So, it is a last resort. But again, as I said earlier, it's if it's a choice of the patient being able to get it on or not being able to get it on, then absolutely. When we talk about zips, something that we always like to consider is the potential risk for trauma. So it's important to think about zips where we're actually asking for those zips to be put into the garment. So something we would avoid, for example, would be putting a zip down the tibial crest, because oftentimes that tibial crest is the most vulnerable area on a limb. If it's down the side of a hosiery item, then we would avoid going over the malleolus, because again, it's a bony prominence. So they're all the sorts of things that we would need to consider. But there's also a huge variety of donning aids that are available in the marketplace. And certainly across the UK, a lot of those are available to us on FP10. So Nat had a beautiful picture there of a variety of donning aids that are available to us to use. I think one of the biggest challenges in clinics is that we're often so restricted with time that, and it's not because we mean to do it, but we're busy and we just forget, do this, do that, do this, do that. So sometimes we can forget, but it's those simple things such as donning aids, rubber gloves, the latex coated gardening gloves. I think you can buy them for £1 from Poundland. It's those simple things that can make a massive difference to, enabling a patient to get the hosiery on. Often the most challenging part is over the heel and the ankle.
We've just had a really, really positive comment from Christy in the chat. She loves compression. It's changed her life. How positive is that?
Fantastic. Thank you so much, Christy. It's wonderful. Wonderful to hear that.
There's another question. Is there a minimum amount of time for compression to be used for best results? And is there a maximum time frame?
That's a fantastic question. I guess if we're looking at a true lymphedema, so if we take into account that the lymphatic system is damaged, it's failed, essentially we're looking at the necessity of compression for life, because the compression hosiery is actually doing what the body is no longer able to do. So if we're looking at a time frame, if it's a reactive edema or traumatic edema, a dependency edema, so a short-term edema, then yes, we may need graduated compression in the short term. But if we're looking at a chronic edema or a lymphedema, then it would need to be compression for life. So has that answered the question fully? I think I might have missed a part.
And is it compression better in the first 3 months? Some patients find they need to renew their garments every 3 months, and others can manage having their garments for 6 months. Is it on is it personal, individual basis?
Yeah, I think I'll probably revert back to that original question that we had: how long is compression good enough for want of a better description? And I think, looking again back to the manufacturer, 3 months, 6 months, but a lot of that is determined entirely on the patient's circumstances, individual circumstances, whether they've been taught to don the garment properly, whether they've been taught to doff it correctly, because all of those things, can certainly add to the wear and tear. Answering your question around, is hosiery the most effective within the first 3 months? I guess, again, I would also go back to, it depends entirely, one, on the manufacturer, the period of time that they guarantee the garment for, and number two, the donning and doffing and the individual patient's circumstances. Are they a runner? Do they have long fingernails? Do they have long toenails? So all of those things will certainly be, can add to the wear and tear of the garment.
And what's the recommended frequency of washing, would you say, to get the best out of the compression on the garment?
So I think that is, when we look certainly from the UK's perspective, where we have the wash one, wear one, everyone's personal hygiene standards differ greatly. I think it more comes down to patient comfort, how often they're applying their emollient, when they're applying their emollient. Is that creating a build-up on the lining of the hosiery? If that's the case, then, obviously those patients are going to want to wash their garments more frequently. But I think, it's very, very difficult to sort of sit here and say, well, they should be washing them every other day, or because it really, really does depend on the individual. Some patients perspire more than other patients. So, yeah, that's a hard one. And I've dodged that really a bit. I do apologise for that.
No worries. Cheryl.
So we've talked we've talked mostly about garments, but the same applies for wraps, I guess, as well, about the washing and the individual care, specific to a patient, how long they're wearing them, whether, like you say, whether they perspire, etc.
Yeah,
it'd be similar advice, wouldn't it?
So it is very similar, although there is a slight difference with the adjustable Velcro wrapping devices, in that most of them actually come with a separate liner. So you do tend to find, and actually it's one of the most common things that patients will ask me, both in my Hadnam role and in clinic as well. They'll say, should I be washing my wrap every other day? And the answer to that question is, well, is your wrap actually getting dirty, or is it the liner that you feel needs to be washed? So personally, I think that's one of the lovely things about wraps, is that, you can maintain their integrity for a longer period of time by changing the liner on a more frequent basis.
Yeah, Jenny's put in a comment actually in the question section, saying she wears a cotton tubular padding made by Frotte underneath her easy wrap, and that wicks away the sweat, and it's softer on her skin as well, so she finds it much easier to.
Thank you. Was that Tanya?
Jenny,
thank you so much for that, Jenny. That's great feedback. And on that point, Tubifast is also very helpful. Because another challenge that we have is not all of the liners are actually available. on prescription. So whilst, yes, patients are able to purchase them directly, additional liners, financially, especially in these challenging times, it's not always possible for patients to do that. So something as simple as Clinifast, yellow line, blue line would suffice as well. But that's great feedback, Jenny. Thank you for that.
We've got another question. It's about swelling. If the swelling, is it good for swelling to pit or not? So when wearing compression garments, should there still be pitting of the skin?
Okay, so that's a really interesting question, and I think generally, and I am speaking generally, what we would be looking for from a compression garment is for that garment to control and manage that edema. There is an exception, and when I say that, there are some products that are available in the market that are kind of active compression garments. So one of those garments, for example, that I frequently get asked questions about is the Comfy Wave, the Hadnam Comfy Wave. It's a very unique, bespoke product, and it's quite concerning for patients if the clinician hasn't warned them previously that it's a dynamic product. So it actually works purely by the knit of the fabric. It works to shift that edema and to open the initial lymphatics. So it does leave quite severe trail marks in the skin, so in the edematous tissue, and patients can find that quite alarming if they're not expecting it. So I hope that's answered the question. So for some active dynamic compression, where we're wanting that to work with us within the garment, yes, that is perfectly acceptable and perfectly normal. If the edema is pitting, so if we're not able to contain the edema with the garment that the patient is in, so in other words, if we're getting rebound edema whilst the patient is wearing the garment, then we need to look at two other factors. And those other factors are, we may need to increase the class of compression, or we may need to look at a stiffer fabric. So in that context, I'm referring to a higher static stiffness index.
In response to the Comfy Wave, I've put a few patients in that because it's quite new, yeah. And they've had phenomenal results from it. Amazing, actually. It's softened their limb. So that's me speaking to a clinician, but it's been really good.
Good. And I have to say, and I know Tom would certainly agree with me, in fact, everyone at Hadnam, it has surpassed our wildest expectations. I mean, initially, we launched it as a nighttime garment, but that I think that idea is completely scrapped now, because the results that we're getting with patients who have previously not been able to wear any type of compression, so whether that was for donning and doffing reasons, whether it was through neuropathy and pain, or just the sheer comfort, patients are getting tremendous results with it, tremendous reduction, and it's a class 1 garment. So yeah, we're to say we're delighted is an understatement. And now to have the upper limb and the lower limb available on FP10, that's made us even happier. We just need the rest of the range on now. Thank you for that.
Jenny's given us a follow-up actually about her easy wrap, and she says that the padding also means she doesn't have to wash her easy wrap as much, and she washes hers about every 4 days, but changes the padding more frequently. So that concurs with what you've said, Tess.
Fantastic.
So, thanks.
Oh, lovely. Thank you for sharing again, Jenny. That's lovely. Great feedback.
There's another question. Someone's having enormous difficulty getting custom-made garments to fit correctly due to the manufacturing tolerance and delivery delays. Do you have any recommendations as to how we can get access to better fitting garments?
Oh my goodness, how long's a piece of string?
That's a juicy one as well.
That's a loaded question. No, I'm joking. It is a challenging one. I mean, with custom made garments, it might help to kind of understand the process. I'm not sure who has asked that question, whether it's come from a patient or a clinician, but I'll briefly cover it because I do think it's really helpful for us to all understand the difference. So when we do our 101 measurements, which it does seem like it's 101 measurements for a custom made garment, those measurements are then sent off to the manufacturer, which most of the hosiery manufacturing companies of flat knit products are in Germany. So those measurements are then entered into a CAD, so a computer assisted design. So it's entered manually into the system. So when I say manually, there is one point in the process that is open to human error in the manufacturing process. So the other error that is possible is in the translation from the clinician to the prescriber, to the wholesaler, to the manufacturer. So I'll back that up a little bit to kind of explain how that all works. So we all have different supply routes to our various clinics. If you are lucky enough to have a clinic budget and you can access your products directly via your clinic, that is very, very helpful because 9 times out of 10, the clinic will have direct access with the manufacturers. Why that's such a benefit is because it reduces the risk for error. So the clinician is scanning and emailing off that measurement form, or some companies are offering an online service. So you can literally type in the measurements. Now that does also not completely remove the error rate for human error, because one wrong button that's entered, you can put in a 2 instead of a 3 or vice versa. So there is always room for human error along the way. But let's take the clinic scenario. So that would then go off to the manufacturer and come back, and that's easily resolved. More and more nowadays, due to, I can only assume, the restrictions, the financial constraints that are being put upon the NHS, most of us are now being asked to access our garments via FP10 or prescription. Is the route that we're being asked to access. Now that's where it gets very, very complicated. One, from a time perspective, and 2, from an errors perspective. And it's important to sort of understand that process and what actually happens. So as a clinician, we're not all nurse prescribers or prescribers. So it's important to understand that in the community setting, there are now becoming more and more nurse prescribers, which is very helpful, and more in the lymphedema services as well. If you can prescribe a garment yourself, that will be very, very helpful, because you can prescribe the garment. You can then send off the measurement form directly either to the pharmacy or to one of the available DAC providers. So a DAC provider, in layman's terms, is an online specialist compression hosiery. That's not a DAC provider, that's for our compression hosiery, but they're an online pharmacy supplier. So they're becoming more and more of those. But in the UK in particular, we have access to 2 phenomenal companies called Daylong and Patient Choice. Now, the beauty of using the specialist services such as Patient Choice and Daylong is that they are compression specialists. So their customer service team will pick up immediately if there's something wrong with the either the PIP code that we've provided or the prescription or a garment. We might sometimes they might get requests for an open toe when a garment doesn't even come in an open toe. If it goes via the pharmacy route. So it goes via a GP. So a letter is sent to the GP requesting that to be prescribed. We're then relying on the GP to send the measurement form to the pharmacy then to prescribe the correct product. They then send that on to a wholesaler, and the wholesaler then sends that on to the manufacturer. So the reason I've kind of tried to briefly explain that whole process is because you can pick up already there are many points for potential errors along that pathway. So I don't know whether the errors have occurred because of that. What we often find is that through sheer frustration, I'm sure, pharmacists are used to dealing with medications. They're not used to dealing with the world of compression hosiery. So oftentimes they get confused between what is, a RAL class 2 compression and a British standard. So, we often get hosiery back that we've prescribed or we've requested it as a class 2 RAL, and it will come back as a class 2 British standard, because that's the product that they're the most familiar with, or the first one that comes up in the system that they can see. So there's multiple rooms for errors. From a manufacturer's perspective, yes, we all have, we all have errors within the manufacturing process. We try to keep it to a minimum, and I certainly know from Haddenham's perspective, we have a duty of care to monitor that error rate. So, we do our very, very best that if we have a run of inconsistencies, for example, on below-knee garments in custom made, then we investigate it to resolve the problem. Within each organisation as well, there's clinical advisors and account managers or reps, area managers. So there are a number of people within each organisation that can certainly help you to troubleshoot if you are having problems with custom made / made to measure garment. So I hope that helps.
It's a really great question, but I'm going to have to flip it on its head. Tess, sorry.
No, Cheryl.
Because it turns out that Ian, who asked the question, actually is a patient. So how could a patient help influence that process if they're experiencing ill-fitting garments?
Fantastic, Cheryl. Thank you for that. What I would say to Ian is to please do go back to your lymphedema service and just explain this isn't right, and do everything in your power to get it resolved. From a manufacturer's perspective and from a nurse specialist perspective, we will all certainly do our best to get the issue resolved for you.
Yeah, and I think that's important to say that the patient shouldn't feel embarrassed or not be very vocal about. If there's something wrong with a garment, they need to say. It's important that they say, because damage could be done if it's an ill-fitting garment, and so it's really important that a patient speaks up if there's an issue with any part of their treatment, not just their garment.
No, most definitely, Cheryl. And it is one of the things that, we do often see in clinic. And I'm sure the clinicians that are on this call can empathize with this. The patient will come in for a review only for us to discover that, that they haven't worn their compression hosiery at all. And because they couldn't get it on, or because it was ill-fitting. So again, maybe sometimes it's lost in translation, or we're so busy we forget to remind the patient, if the garment doesn't fit you, or you're having difficulties in any way, you can't get the garment on, please get back to us. So yeah, a worthy reminder of that.
And often the first made-to-measure garment is more like a prototype, isn't it? And then it just needs tweaking afterwards. So maybe like a couple of centimetres off the height of the length, or a couple of centimetres off the foot, or a bit more a bit tighter around the ankle. So sometimes it's like it's a prototype. This is what it's like. Let's tweak it to try and make it feel a bit better for the next time round. So as a clinician, that's how I approach made to measure garments.
Yes, absolutely. We love tweaking.
Absolutely.
Not twerking, tweaking.
Both.
I've got quite again, we haven't got that much time left, but I've got quite a sort of difficult, controversial, if you like, question. Given that the condition's lifelong, access to garments is key. We've agreed that.
Yeah.
But is there risk that garments will not be available on prescription in the future?
Oh, my goodness.
We hope not.
We hope not. No, no. Well, that's something I would love to be able to answer, but it's beyond my scope.
Yeah.
But again, Cheryl, you know, we would all, yeah, absolutely work very, very hard to make sure that that does not happen. But who knows? You know, we're in challenging times financially, but I'm sure we could fight the good case for that.
Macmillan will, for patients who have lymphedema which is cancer related, they have free prescriptions on FP10. And a lot of patients don't realise that after having cancer, that they're entitled to this prescription or free prescriptions, and that doesn't have to be cancer related. So they can have their lymphedema garments without paying a prescription charge, but they can also have, if they've got an ear infection and they need antibiotics, even though it's not related to their cancer, they can still have free antibiotics to attend to their infected ear or any other medical problems. So, yeah, so just say that with cancer-related patients with lymphedema.
Yeah, that's great, Rachel. Thank you for that.
We've just had a couple of, the last couple of questions have just been relating to midline edema garments, talking about garments for genital edema and saying about how limited compression applications are for that area, and head and neck obviously we know is another difficult area to treat. Do you know of any new innovations or suggestions, you know, what to do with midline garments, just briefly? Because
yeah, no, absolutely. I mean, it's something that we, you know, as manufacturers, we will always continue to, you know, to submit for new listings, new categories within the drug tariff. But there's certainly from Hadlam's perspective, the range is ever growing. So there are additional comfy wave products. So there's a breast band, there's an abdominal band. Yeah, so certainly we're also looking at other more innovative head and neck garments. So there are a variety of garments out there for midline. It's just knowing where to access them. You know, we also distribute the Ito range of garments, so there's a huge range of sized available as well as custom made, and Hadlam are traditionally very generous with their sampling, and as a medium-sized company, family-owned business, we're very responsive and very flexible to working with clinicians.
And for patients that have mild swelling in those areas, things like sports attire, cycling shorts and things like that can, if they don't need strong compression, things like that can still make a difference.
Absolutely, Cheryl. Absolutely, yes, most definitely. I mean, it's I guess the big difference is you're getting, you know, and actually as a clinician, that is always where I will start before I go to a prescribed compression garment, because they are very expensive for the patients to buy. So yeah, that's absolutely right. I will always suggest that they try, you know, oh gosh, what do they call it? Support hosiery. You know, like Spanx is what I'm thinking, that type of hosiery, you know, for shorts, in a shorts and sort of bra as well, before moving on to, you know, prescribed compression, which is obviously the Ito range.
It's just sadly, Stacey's just made a really valid comment. Unfortunately, a lot of midline compression garments aren't available on prescription, which is always a struggle, but hopefully that might change in the future.
Fingers crossed. We can only hope.
Well, I think we've kind of come to the end of our hour. We've had a really good discussion, and any of the questions that we haven't covered in the chat, we will put together and we will publish in News and Views, which is our quarterly newsletter. So I think it's just all that's left to say is thank you for attending the webinar this evening, and thanks to our sponsors Haddenham Healthcare, Essity and Juzo. And can I remind you that if you've registered for any of the webinars during the week, you'll be able to watch again following the link that will be sent in the follow-up email. Otherwise, you'll be able to access the webinars when they're launched on the YouTube channel. And that's hopefully going to be at the beginning of next month. But like Nat said in her presentation, if you'd like to join BLS as a friend, that's free. Or maybe even consider joining as a full member, and both grant access to a vast array of information about lymphedema and lipedema and garments and what to do about skincare, etc. You just need to visit the BLS website, which is www.thebls.com, and just click on membership. But thank you once again for attending and contributing with all the questions and the discussion. I think we've had a really valuable discussion tonight. And as I say, we'll be following up with any questions from the whole week in the newsletter. But join us tomorrow for our final webinar of the week. It's a really entertaining session from Professor Neil Pillar, who's speaking about supporting patients' self-management and empowering patients to positively impact their lymphedema. So that will be really interesting. If you've not registered yet, it's not too late. There's still places. Just go to the links that are on the website as well. And then following this, our next event is the extremely successful annual conference in October. And that's this year, it's at Chester Racecourse, and we hope that we'll see some of you there. And again, look on the BLS website for some more details. So it just leaves me to say goodbye and thank you very much. And so it's goodbye from Tess, Rachel and me. Good night. Have a good evening.
Thank you.
Bye.
Bye-bye.